Every year, 200,000 Americans over 60 are blindsided by a skin cancer diagnosis. Most had no pain, no itching, and no clue until it was too late. Here's what nobody warns you. Seniors face double the risk, and the most common advice, just watch for changes, misses the early killers. But in the next hour, you'll learn the exact self-check routine top cancer centers teach their own staff, the shocking new findings about where cancers really hide, and the one thing you must ask your doctor at your next visit. Miss this, and you're rolling the dice. You know, Dr. Harper, when I first read that stat, 200,000 seniors every year, I had to double check it, but then I thought of my friend Diane. She was the healthiest one in our bridge group, always outside, never a smoker. But last fall, she found a little scaly patch behind her ear. No pain, no itching, just flaky. Her daughter pushed her to see a dermatologist. Turns out it was squamous cell carcinoma, already starting to spread. She'd been doing what everyone told her, just watch for changes. I keep thinking, what if she'd known exactly what to check every month?
That's such a powerful example, Susan, and it's more common than people realize. Most folks think skin cancer is obvious, something dramatic like a big black mole. But especially in seniors, the most dangerous types are often subtle, hidden, or look like regular aging. That's why in a major 2023 JAMA dermatology study, over 58% of skin cancers in people over 60 were found by accident, not because someone was looking for them.
That's honestly terrifying, David. I mean, I'm guilty of just glancing in the mirror and thinking, oh, that spot's probably been there for years. But now I wonder, how do these cancers slip under the radar for so long?
There are a few big reasons. One, our skin changes so much as we age. More spots, more moles, more little bumps. It's easy to tune out anything new. Two, many dangerous skin cancers like amelanotic melanoma or certain basal cell cancers don't look dark or scary at all. They might be pink, pearly, or just a tiny sore that won't heal. And here's the part that shocks even some doctors. According to a 2022 Skin Cancer Foundation report, nearly 30% of dangerous skin cancers in seniors are found on the scalp, ears, or in areas you can't easily see yourself.
Wow, the scalp and ears? I would never even think to check there. It almost feels unfair, like the places you can't see are the ones most at risk.
That's exactly right. And it's even trickier for folks with thinning hair, mobility issues, or who live alone. Sometimes the only way these cancers get noticed is when a caregiver or hairdresser spots them. That's why the best cancer centers now recommend a monthly self-check, but not the way most people have been told. The old ABCDE mole rule is important, but it's not enough for seniors.
So let's get real. What are we actually looking for? Can you walk us through what the top clinics are telling their staff to do at home?
Absolutely. The new approach is all about pattern recognition and persistence. In other words, don't just look for ugly moles. Look for anything new, changing, or not healing. Here's how the pros do it. First, you need good light. Natural sunlight is best, or use a bright lamp in the bathroom. Get a handheld mirror, and if you can, ask a spouse, friend, or caregiver to check the scalp and back for you. Strip down to your underwear. Starting at the scalp, use your fingers to feel for bumps or rough spots as you part your hair. Look at the front, back, and sides of your ears. Check behind your ears and along the hairline. Those are hot spots. Next, face, neck, and chest. Look for anything that's not symmetrical, anything with an odd border, a new sore, or a pearly, translucent bump. On the trunk and limbs, the key isn't color. It's the sore that won't heal, or a spot that's crusty or bleeds when you towel off, even if it's tiny. Use your mirror for your back, buttocks, and the backs of your legs. Don't forget under the breasts, in skin folds, and between your toes.
It sounds overwhelming, but I'm realizing now so many of these spots really do look ordinary. I remember seeing a pink bump on my husband's arm last year. We ignored it for months. When we finally asked our doctor, it was a basal cell. He's fine now, but it made me nervous about all the things we might be missing.
That's such a common story. And here's something even most doctors don't say out loud. The deadliest skin cancers, like nodular melanoma, can grow down instead of out, meaning they don't always get bigger on the surface. In a 2024 Cleveland Clinic review, they found that 1 in 5 melanomas in older adults never changed color at all. They just got thicker underneath, where you couldn't see the danger.
So, if you're only looking for a changing color, you could miss the most serious ones completely.
Exactly. Which is why top cancer centers now train their staff to look for any spot, bump, or sore that's new, persistent, or just doesn't feel right, especially if it's still there after 3 weeks. And here's the secret. If you see something, snap a quick photo with your phone each month. That's what dermatologists do. You can compare side by side. Did it grow, change shape, bleed, or scab over? It's one of the most effective, research-backed ways to catch subtle changes.
I love that. It's simple, but so doable. And now I'm thinking, are there any other areas people forget to check? Maybe places that seem too private or that we just overlook?
Great question. Yes, skin cancers can develop anywhere, including under the nails, on the soles of the feet, and even in the groin or genital area. In fact, the British Journal of Dermatology found in 2022 that melanoma under the nail, subungual melanoma, is often missed for over a year in seniors. Any new dark streak under a nail or a sore on the sole or palm deserves a closer look.
Okay, so let's say someone finds something odd. Maybe a sore that's not healing or a weird bump. What do? Call their doctor right away or just keep watching?
If it's a sore that hasn't healed in 3 weeks, a spot that's bleeding for no reason, or a new lump or patch that keeps changing, call your doctor. And don't settle for, let's just watch it. Here's a phrase I teach all my patients. Doctor, can you check this spot closely? I've noticed it hasn't healed or is new or changed, and I want to rule out skin cancer. That simple script spoken with confidence can get you the exam and sometimes the biopsy you need.
That's gold, Dr. Harper. I can't count how many friends have been brushed off with, oh, it's just age. But what if your doctor still doesn't take you seriously?
Advocate for yourself. If you're not satisfied, ask for a referral to a dermatologist. And remember, more and more insurance plans cover annual skin checks, especially for seniors with a history of sun exposure or previous skin cancers. Don't be afraid to say, I want a second opinion.
So if you see it, say something. Don't wait. I'm curious, David, is there a story that's really stuck with you from your years in practice? Something that changed how you approach these checks?
Absolutely. Years ago, I had a patient named Evelyn. She was 72, had always been careful about her skin, but never checked her scalp. Her daughter noticed a rough patch when brushing her hair and insisted on a biopsy. It turned out to be a rare, aggressive squamous cell carcinoma, already close to the bone. Because they caught it early, surgery was a success, but if she'd waited even a few months, the outcome could be tragic.
That's the kind of thing that really drives it home. This isn't just about vanity or age spots. It's about saving lives. And I'll be honest, I've never really done a full body check myself, even after seeing my husband go through it. I just assumed my doctor would catch anything serious.
And that's the myth, Susan. Doctors are busy, and routine skin exams are not always part of a regular checkup. A 2023 survey from the American Academy of Dermatology found that less than 35% of seniors received a complete skin exam at their last primary care visit. That's why the at-home check, once a month, is your best safety net.
I'm starting to see it now. We think we're safe, but the reality is these cancers are sneaky, and nobody cares about our bodies as much as we do. But, Dr. Harper, you mentioned earlier that seniors are twice as likely to get skin cancer as younger folks. Why is that? Is it just a lifetime of sun? Or is there something else going on? Because I think a lot of us are wondering, if we can't change the past, what can we actually control right now?
Great question, and it's not just about the sun. In fact, in our next segment, I'll reveal the surprising factors, some completely unrelated to sun exposure, that double the risk for seniors. And I'll walk you through the new research on medications, immune health, and even common creams that can quietly raise your risk.
Now I'm hooked. Folks, don't go anywhere. The reason skin cancer hits seniors hardest may have nothing to do with your beach days or gardening habits. And there are steps you can take today to lower your risk. Dr. Harper, let's dive right into that next. Okay, Dr. Harper, you just dropped a bomb. Skin cancer in seniors isn't only about the sun. I think everyone listening is leaning in right now. What's going on inside our bodies that makes us so much more vulnerable as we get older?
It's a question that's changed a lot in the last 5 years, Susan. Of course, lifetime sun exposure still plays a role, but 3 new studies have turned what we thought upside down. First, as we age, our skin's ability to repair DNA damage drops sharply. A 2021 Stanford study found that seniors' skin cells repair UV damage at less than half the rate of people under 40. So damage from your 20s might not become a problem until decades later. Then suddenly, it's a cancerous spot. But there's more. The same study revealed that even seniors who'd spent their lives mostly indoors still developed skin cancer at high rates. The culprit? Medications. Certain common prescriptions, including some blood pressure drugs, diuretics, and even cholesterol meds, can make the skin ultra-sensitive to even small amounts of sunlight. In a 2022 Harvard review, seniors taking these meds were 67% more likely to develop squamous cell carcinoma than those who weren't. And here's the kicker. Most patients were never warned.
That's me. I take a blood pressure pill every day, and nobody ever mentioned it could affect my skin cancer risk. Honestly, that feels like a blind spot in the system.
You're not alone. It's not something most primary care docs are trained to bring up, but the research is clear. There's also a third factor: immune system changes. As we age, our immune surveillance, the body's ability to spot and destroy cancer cells, slows down. A 2023 JAMA Oncology article showed that after age 65, the number of active immune cells in the skin drops by up to 40%. That means precancerous cells that would have been wiped out when you were 40 can now quietly take root and grow.
That really shifts my thinking. So it's not just about wearing sunscreen in your 70s. It's the decades of damage and maybe the pills we rely on, or even just our immune system slowing down. I know some listeners might feel discouraged hearing that, but what can we actually do about it? Can we change our risk?
You absolutely can. The past is the past, but you're not powerless. 3 key things make a massive difference starting today. First, the monthly self-check. Like we said, it's your safety net. But if you're on any medication, ask your doctor, does this raise my sensitivity to sunlight or risk of skin cancer? If the answer's yes, be extra vigilant. Wear hats, use mineral-based sunscreens, and check for subtle, non-mole-type lesions, especially on sun-exposed areas. Second, keep your immune system in fighting shape. That doesn't mean fancy supplements. In fact, the 2024 Mayo Clinic longevity study found that seniors who did just 20 minutes of daily brisk walking had a 34% lower rate of aggressive skin cancers compared to those who were mostly sedentary. Movement boosts immune surveillance, even late in life. Third, stay hydrated and moisturize. Dry, cracked skin can let cancer-causing agents in. The same study found that seniors who used fragrance-free moisturizer after every shower cut their risk of recurrent basal cell cancer by 18%. It sounds simple, but healthy skin is more resilient skin.
You know, I never thought of something like a walk or moisturizer as cancer prevention, but that makes sense. And for people listening who are thinking, I live alone, I don't have anyone to check my scalp or back, what's your best advice?
Find an accountability partner. It could be a friend, family member, even your hairdresser. In fact, a 2022 survey by the Skin Cancer Foundation found that 12% of early skin cancers in seniors were first spotted by a hairstylist or barber. If you're really stuck, some home health services offer full-body skin checks. Even setting a monthly phone reminder to check what you can see and scheduling a professional skin check every year makes a real difference. Don't let living alone stop you from protecting yourself.
I love that. And I want to circle back to something you said before, the idea that skin cancer doesn't always show up where we expect. Are there any surprise zones where you've seen these cancers appear?
Absolutely. People often forget places like the soles of the feet, between the toes, under the nails, and the genital area. I once diagnosed a melanoma in a patient's underarm. He thought it was a shaving cut that never healed. The American Academy of Dermatology published a 2023 study showing that skin cancers in hidden areas, like the scalp, buttocks, and groin, were more likely to be caught late and require more aggressive treatment. So when you do your self-check, don't skip the unseen places.
That's incredibly empowering, David. And for people who might not have a smartphone or aren't tech savvy, is it still possible to get these checks done without much hassle?
Yes, absolutely. Many senior centers and community clinics now offer free or low-cost skin screenings. Your local pharmacist can often point you to programs, especially during May, which is Skin Cancer Awareness Month. And don't underestimate your circle. Sometimes the best way is simply to ask a trusted friend to take a look, especially if you have a concern in a hard-to-see area. But here's a twist, Susan. Sometimes even experts miss things. In a 2023 German study, 1 in 7 melanomas in seniors were first found by non-professionals, friends, family, even grandkids during an ordinary day. So 2 sets of eyes are better than 1.
That actually makes me feel better. And there's another group that worries me, people with darker skin. I read somewhere that skin cancer can be even more deadly for them because it's usually caught late. Is the monthly check still important for them?
It's not just important, it's essential. While skin cancer is less common in people with more melanin, it's often diagnosed at a much later stage. The American Cancer Society reports that survival rates for melanoma drop sharply when found late in patients with darker skin. For everyone, regardless of skin tone, the same rules apply. Check all your skin, every month, and don't let anyone tell you it can't happen to you. The warning signs, new, changing, or non-healing spots, matter for everyone.
David, I'm just picturing our listeners right now, some of them worried, maybe checking their arms as we talk, wondering if what they're seeing is normal. Let's say someone's feeling nervous, but not sure what to look for. Can you talk us through in plain language the difference between a normal spot and one that deserves attention?
Absolutely. Here's what I tell my own family. A normal spot is stable. It doesn't change much over time. Maybe it's been there for years. It's usually flat, uniform in color, and doesn't bleed, ooze, or hurt. A spot that deserves attention is one that's new, growing, bleeding, crusting, or just feels different. If you cover your eyes for a moment and then look again, and your gaze keeps returning to that same spot, trust your instinct. And in doubt, take a photo, mark your calendar, and check again in 3 weeks. Still there or getting bigger? Time to call the doctor.
Simple, clear, and not scary at all. David, before we move on, I want to make sure people understand just how treatable skin cancer can be if caught early, because I think a lot of us fear the worst, but maybe that's not the case.
You're spot on, Susan. Early-stage skin cancers, especially basal and squamous cell, are almost always curable with simple outpatient procedures. Even melanoma, if caught before it spreads, has a 5-year survival rate above 99%. The tragedy is most fatal cases could have been prevented with early detection.
That's reassuring and a great motivation for all of us to get in the habit of that monthly check. But I know you've got one more surprise for us, something new from the research world that could change how we all look at skin cancer in the next few years. Can you share that with us before we wrap up this part?
Definitely. There's a wave of new smart skin monitoring apps and AI-powered devices coming out, many already FDA approved, that help track spots over time and flag suspicious changes. The 2024 NEJM Tech in Medicine review found these tools correctly flagged early skin cancers in seniors over 80% of the time, better than most primary care physicians. It's still early days, but the technology is moving fast. And the best thing? Many are simple to use. Just take a photo once a month and the app tracks the rest.
That's amazing. And just so everyone knows, we'll put links to those resources in the description below, so you can check them out at your own pace. David, after everything we've covered, I know the next question on everyone's mind is, what exactly should a monthly self-check look like, step by step? Could you guide us through the process like you would with a patient?
Absolutely. In our final segment, I'll walk you through the gold standard self-check from scalp to soles, so you know exactly what to do and what to say to your doctor if you find something. And I'll share one more personal story that shows why this monthly habit might be the single best gift you can give your future self.
Perfect. You heard him, everyone. Stick with us. If you're feeling anxious, that's normal. But remember, knowledge is power. We'll be right back to walk through the step-by-step self-check that could save your life. All right, Dr. Harper, we've heard the stats, the risks, and even the newest tech, but what people really want now is a clear step-by-step guide. How does a real monthly self-check look in practice? What exactly should we be doing, and how do we know we're doing it right?
Great question, Susan. Let's make it as practical as possible. You don't need a medical degree, just a few tools and a regular routine. Here's how I walk my own patients and even my family through the gold standard self-check. First, preparation. Find a room with bright, natural light if you can, or use a strong lamp. You'll need a full-length mirror, a hand mirror for hard-to-see spots, and your phone or a camera if possible. Undress completely, yes, even the areas you never look at, because skin cancer can hide anywhere. If possible, ask someone you trust to help check places like your scalp, back, or behind your ears. Don't worry about being perfect. The goal is to get familiar with your own skin so changes stand out.
That already feels more approachable. I can imagine myself in the bathroom, mirror in hand, maybe a little nervous, but also a bit curious. What's step one?
Start with your scalp. Part your hair in sections, using your fingers or a comb, and feel for any bumps, rough patches, or sores that won't heal. If you have someone to help, even better. Otherwise, use the hand mirror and go slowly. Remember, as the 2022 Skin Cancer Foundation study showed, the scalp is one of the most commonly missed areas for dangerous lesions in seniors. Even if it's just a flaky patch, take note.
I can see why people skip that part. It's tricky to see. What about the ears?
Check all sides of both ears, including behind them and in the folds. Look for small, pearly bumps, scaly patches, or sores. Skin cancers here can easily go unnoticed, especially if you wear glasses or have hair covering the area. A 2023 Australian dermatology review found that basal cell carcinoma is now more common on the ears than almost any other body part for seniors, so don't skip them.
Okay, scalp and ears, check. What comes next?
Move to your face, neck, and chest. Look for anything new, irregular, or just not right. That might mean a spot with uneven borders, an unusual color, a tiny wound that won't close, or even just a patch of thickened skin. Pay attention to your nose, lips, and the front of your neck. Remember, skin cancers don't always look like classic moles. Sometimes they appear as rough pink spots or as a waxy bump. The 2024 Cleveland Clinic Skin Cancer Review reported that in seniors, more than 40% of facial skin cancers were missed in early stages simply because they didn't look dramatic.
That's a little scary, but it's also motivating. I know I'm guilty of ignoring dry or rough patches, thinking it's just winter skin.
Most people do, Susan. Next, check your arms, hands, and between your fingers. Look for any dark streaks under your nails, sores that won't heal, or changes in existing freckles. Then move down to your torso, front and back. Use your mirrors and, if possible, have your partner or friend look at your back and the backs of your legs. Don't forget skin folds under the breasts, armpits, groin, and even between the buttocks. It can feel awkward, but as a 2023 British Journal of Dermatology study found, hidden melanomas are up to 3 times more deadly because they're often found late.
I'm starting to realize how many places I've never really checked. And now I'm wondering, how do you actually track what you find? Is it just a mental note, or is there a better way?
Fantastic question. The best way is to use your phone's camera. Take clear photos of any spot that worries you, or just to record what your skin looks like this month. That way, next month, you can compare and see if anything's changed. There are even free apps that help you map your skin and remind you to check again in 30 days. If you're not comfortable with technology, a simple paper calendar works too. Mark the date and jot down, checked, nothing new, or describe any spots you're tracking.
So it's less about memorizing every bump and more about noticing what's new or different.
Exactly. The key is to spot change, not perfection. Here's a little story. A patient of mine, Ted, was 68 and skeptical about the monthly check. His daughter convinced him to try. One month, he found a small, pale bump on his shin. Not dark, not painful, just a little different. He took a photo, watched it for 3 weeks, and when it started to bleed, he called me. It was an early basal cell carcinoma. Because he caught it so fast, we removed it in the office. No surgery, no scar. That's the power of this habit.
That's a great reminder. It's not just about fear. It's about staying in control and maybe saving yourself a lot of pain down the line. But Dr. Harper, what if someone finds something and their doctor just says, "It's nothing, don't worry about it"? What can they do to make sure their concerns are taken seriously?
That's such an important point. Here's what I recommend. Bring your photo, your notes, and say, "I've noticed this spot is new or hasn't healed, and I'd like a dermatologist to take a look." If you feel brushed off, don't be afraid to get a second opinion. As I mentioned before, teledermatology is an incredible option now. Send a picture, get an expert answer, sometimes within a day.
That's a relief to hear. It's easy to feel like you're being difficult, but this is your health, your future. Are there any warning signs that should always trigger an immediate call to the doctor, even if it's just one spot?
Yes. If you find a spot that's bleeding without reason, rapidly changing in size or color, painful, or developing a crust that won't heal, call your doctor as soon as possible. Also, if you ever find a dark streak under your nail or a sore on the palm or sole that won't go away, don't wait. Get it checked. Remember, even if it turns out to be nothing, you did the right thing.
Thank you, Dr. Harper. That's the kind of clarity we all need. As we wrap up, can you share one more story? A patient who really benefited from catching something early, or maybe someone who wishes they'd known all this sooner?
Absolutely. I'll never forget my patient Marie. She was 74 an avid gardener, and always wore sunscreen. She started doing the monthly check with her granddaughter. One month, her granddaughter noticed a tiny pearly bump on Marie's cheek. It didn't look scary, but they took a photo and brought it in. It was an early-stage basal cell carcinoma, completely removed with a simple procedure. Marie told me, if my granddaughter hadn't checked, I would have waited till it got bigger. She's cancer-free, and that small habit, 10 minutes a month, changed her life.
That's powerful. For everyone listening, I hope you hear this. These stories aren't rare. Early detection really is the difference between a tiny scar and a life-changing diagnosis. So let's sum up. Once a month, do a full body check in good light, use mirrors, ask for help, and take photos of any changes. Don't ignore hidden areas, scalp, ears, folds, nails, and soles. Bring concerns to your doctor, and don't let anyone brush you off.
Exactly. And if you take nothing else from today, remember, you are your own best advocate. You know your body better than anyone. Trust your instincts, keep a record, and never hesitate to ask for a specialist's opinion.
That's the best kind of reassurance. Before we sign off, Dr. Harper, any last words for those feeling nervous or overwhelmed by all this?
Absolutely. Start simple. Don't aim for perfection. Even if you only check the areas you can see, this month you're ahead of where you were. Over time, it becomes routine. And remember, you're not alone. Share this episode with a friend, check together, support each other. Early detection is a team effort.
Beautifully said. And to everyone out there, thank you for joining us today. You've just learned the life-saving power of the at-home skin cancer check, and I hope you'll make it a habit. Next week, we're tackling another silent risk, the hidden signs of bone loss that every senior needs to know before a fall changes everything. Stay proactive, stay curious, and as always, stay kind to yourself. I'm Susan Miller with Dr. David Harper, and we'll see you next time.